Hi everyone, welcome to Osmosis. I am your host. Today we are going to talk about a medically enhanced guide to nephrolithiasis, or kidney stones. Just a quick note before we begin. We have a ton of medical illustrations and animations on our social media. So, if you want to help yourself learn and review concepts visually, go ahead and check us out. And if you find value in our animations, please share them with your friends and consider supporting us. Okay, let's get started with the basics. What is a kidney stone? Well, it's also called nephrolithiasis. This refers to a solid, often calcareous mass that forms in the kidneys or other parts of the urinary tract. But we are going to focus on kidney stones today. So how do these stones form? Well, the formation of kidney stones is a complex process that begins with the supersaturation of urine with certain solutes like calcium, oxalate, uric acid, and others. That means that the concentration of these substances is higher in the urine than their solubility. Then, under certain conditions, these substances can crystallize and aggregate together to form a nidus. As more molecules accumulate on this nidus, it grows over time into a clinically significant calculus or stone. Several biochemical and environmental factors can influence the formation of these stones. We will cover some of the main ones here. So the first one we mentioned already. It's urinary supersaturation. When there is more of a lithogenic substance in the urine than can be dissolved, conditions are ripe for crystallization. For example, hypercalciuria is when the urine has too much calcium. Hyperoxaluria occurs when the urine has too much oxalate. Hyperuricosuria happens when the urine has too much uric acid. These three are the most common metabolic causes of kidney stones. On the flip side, low levels of urinary inhibitors can also put someone at risk. Hypocitraturia, for example, is a condition where the urine has low levels of citrate. Citrate normally binds to calcium and prevents crystal formation. So when citrate levels are low, the risk of stone formation increases. The second major factor to consider is chronic low fluid intake. If a person doesn't drink enough fluids, their urine becomes more concentrated. This increases the likelihood of solutes reaching their saturation point and precipitating out of the solution. Other factors like diet, age, gender, genetics, and medical conditions can also play a role in the development of kidney stones. Alright, so now that we know how stones form, let's look at the different types of stones. There are four major types of calculi based on their mineral composition. First is calcium stones, which make up about 80% of kidney stones. They are usually composed of calcium oxalate, but can also contain calcium phosphate. Next are uric acid stones, which account for about 5 to 10% of kidney stones. These stones form in persistently acidic urine with a pH of less than 5.5. Struvite stones, also known as infection stones, are seen in about 10% of cases. They form in the setting of urinary tract infections, with urine-producing bacteria like Proteus mirabilis. Finally, cystine stones are rare and result from an inherited condition called cystinuria. Now let's talk about the diagnosis and workup of nephrolithiasis. Clinical suspicion of kidney stones should prompt an appropriate workup, which usually begins with a history and physical exam. If a patient presents with flank pain radiating to the groin, nausea, vomiting, and possibly hematuria, especially after a recent urinary tract infection, the likelihood of kidney stones should be high. Imaging studies such as non-contrast helical computed tomography or CT is the gold standard for diagnosing kidney stones. This modality has a high sensitivity and specificity for visualizing stones. However, it uses ionizing radiation and intravenous contrast material, so it's not suitable for pregnant patients or those who cannot tolerate iodine-based contrast. In those situations, renal ultrasonography is a good alternative. It is a safe option during pregnancy and does not involve radiation. Additionally, a complete urinalysis should always be performed. It can help identify hematuria, puria, or urinary infection. Also, serum chemistries, including creatinine and electrolytes, can reveal signs of dehydration or electrolyte disturbances. If indicated, a 24-hour urine collection can quantify the excretion of key substances, aiding in the identification of specific metabolic abnormalities contributing to stone formation. Alright, so now let's discuss treatment and management. The approach to treating kidney stones depends on various factors, including the stone's size, location, composition, and whether it is causing obstruction or infection. Small stones that are not causing obstruction or infection are often managed conservatively. The goals are to relieve pain and facilitate spontaneous stone passage. This can involve monitoring the patient closely, providing adequate hydration and analgesics as needed, and even using medications to help relax the ureter and facilitate passage, such as alpha blockers. Larger stones, or those causing significant symptoms or complications, may require intervention. Options include extracorporeal shockwave lithotripsy, which uses sound waves to break up the stones, or a variety of surgical procedures like ureteroscopy or percutaneous nephrolithotomy. After the stone is removed or fragmented, ongoing management may include monitoring for any complications and addressing any underlying metabolic issues to prevent recurrence. Finally, let's cover prophylactic strategies and prevention. Preventing kidney stones is crucial to avoid the pain, complications, and healthcare resource utilization associated with recurrent episodes. And we're going to hit the highlights here because there's a lot to cover. Overall, prophylactic management aims to modify dietary and lifestyle habits, often guided by the results of a 24-hour urine analysis. Increasing fluid intake is the cornerstone of prevention. A typical recommendation is to drink 2 to 2.5 liters of fluid every day. Adequate hydration keeps the urine flowing and helps dilute potentially harmful substances. Specific dietary recommendations can be helpful as well. These include reducing sodium intake, limiting animal protein, maintaining normal calcium intake, and avoiding high oxalate foods if necessary. Medications like thiazide diuretics or potassium citrate may be considered for long-term use in recurrent stone formers with identifiable metabolic abnormalities. Ultimately, a multifaceted approach combining increased fluids, dietary changes, medications, and regular checkups is key to effectively preventing kidney stones. Alright, that's a brief overview of nephrolithiasis. Hopefully this video was helpful. If you want more detailed information, write in the comments. Thanks for watching. Take care and hope to see you next time.